Have you ever wondered about the complexity and intricacies surrounding the issue of abortion? It's a term that refers to a procedure carried out to terminate a pregnancy. This topic is often at the center of heated discussions, igniting passionate debates due to its moral, ethical, and legal implications. It's a subject that intersects with personal beliefs, societal norms, and legal frameworks. But regardless of one's stance, understanding the medical aspects of abortion is crucial for an informed discussion. Abortion is not a one-size-fits-all procedure. There are several types, each with specific indications. At the heart of this discussion are two main types of abortion: medical and surgical. Let's delve a little deeper into each of these. Firstly, there's medical abortion. This method involves taking medication to end a pregnancy. The medication used is typically a combination of two drugs, mifepristone and misoprostol. Mifepristone blocks the hormone progesterone, which is needed for the pregnancy to continue. A few days later, the second drug, misoprostol, is taken to induce contractions and expel the pregnancy. This type of abortion is typically used within the first 10 weeks of pregnancy. It's a process that can be managed at home, but it's essential to have access to medical support if needed. On the other hand, we have surgical abortion. This method involves a procedure to remove the pregnancy from the uterus. There are a couple of types of surgical abortions. Firstly, there's aspiration abortion, also known as suction abortion, which can be performed up to 16 weeks into a pregnancy. This procedure involves dilating the cervix and using a suction device to remove the pregnancy. The second type of surgical abortion is dilation and evacuation, or D&E, which is typically performed after 16 weeks of pregnancy. This procedure involves dilating the cervix and using surgical instruments to remove the pregnancy. Both of these procedures are performed by a healthcare professional in a clinic or hospital setting. It's important to note that these types of abortion are not interchangeable. Their use depends on the stage of pregnancy and the specific circumstances of the individual. For example, a medical abortion may not be recommended for someone with certain medical conditions, while a surgical abortion may not be an option for someone at a very early stage of pregnancy. Remember, everyone's experience with abortion is unique. The type of abortion chosen depends on many factors, including personal preference, health considerations, and access to healthcare services. These types of abortion are not interchangeable. Their use depends on the stage of pregnancy and the specific circumstances of the individual. So, when might an abortion be considered? This is a complex question, and the reasons can be as varied and intricate as life itself. Personal choice often plays a significant role. A person might not feel ready for the responsibilities of parenthood, or they may already have children and feel that they can't provide for another. Medical concerns for the mother can also be a compelling indication for abortion. Serious health conditions, such as heart disease or cancer, can make pregnancy a life-threatening situation. Then there are fetal health issues. If prenatal testing reveals severe abnormalities or conditions that would severely impact the quality of life for the child, some may opt for termination. In some unfortunate cases, pregnancies may result from non-consensual acts such as rape or incest. In these instances, the emotional and psychological toll can be overwhelming, leading to the consideration of abortion. While these are common reasons, it's important to acknowledge that each individual situation is unique. Understanding the process of abortion management is critical, irrespective of personal beliefs. The management of abortion can be bifurcated into two main categories: medical and surgical. Let's first discuss medical abortions. This method typically involves the use of two medications. The first drug, called mifepristone, is taken to stop the pregnancy from growing. Following this, a second medication, misoprostol, is administered to induce contractions and expel the pregnancy. These medications are taken at different intervals, usually within a span of 1 to 2 days. Now, let's move on to surgical abortions. These often involve a procedure known as aspiration. Here, a medical professional uses suction to gently remove the pregnancy from the uterus. This procedure is generally performed in a clinic or hospital setting under the guidance of a healthcare provider. For both medical and surgical abortions, it's paramount to remember that follow-up care is essential. This could involve additional medical appointments, medication, or rest, all designed to ensure the overall health and well-being of the individual. It's crucial to consult with a healthcare provider to understand the best course of action tailored to one's unique circumstances. Ultimately, understanding these aspects of abortion can contribute to more informed, empathetic, and respectful discussions on this sensitive topic.